When you find out you're pregnant, you just think, oh, we're having a baby. You don't ever think my daughter could be going through all these surgeries the second she's born, and what if she doesn't survive? Like, it's really just scary, and just there's so much going through your mind. If you're not willing to fight, then why would they?
My name is Jesse. This is my wife, Kayla, and my daughter, Leilani. We're from Ventura, California.
Leilani has one of the most, if not the most severe heart disease that children are born with, something called hypoplastic left heart. She was diagnosed in utero, so when mom was pregnant, we were able to diagnose this. Congenital heart disease is the #1 birth defect in the world, and it affects about a little less than 1% of babies who are born. So that means if you walk into any first grade class, the odds are that there's a child or two in there who have a congenital heart problem.
They sent us to a specialist who sent us to Cedars, and then once they told us, like, oh, we've seen this before, this is what it is, this is our little miracle, like, she's gonna be great.
Congenital heart disease means you're born with it. These are children who had nothing to do with their outcome. Their parents didn't do anything wrong. They just were born with a heart defect. And those defects can range from something as simple as a hole in the heart, to vessels that are twisted around, to only half a heart, and everything in between.
They said that we were gonna be induced maybe a day before my due date. They wanted it to definitely be planned for when she did get here.
They were very confident. We did not hear that Leilani had a chance until we got to Cedars. We had already priorly made the decision that we're gonna continue fighting when we found out. We're, instead of 50-50 or 20-80, we're 80-20.
She was terribly ill and born with a really severe heart condition that, if left untreated, is 100% fatal.
We know she's gonna need the surgery. We know that it's gonna be within the next couple of days, but it all just depends on how well she's doing and how well her heart's doing.
We were able to do Leilani's first operation without doing much of an operation at all. We call this a hybrid procedure, where it's sort of a very minimally invasive approach to correct their defect.
The doctor's on. That guy, Doctor's on, is something special.
He would just come into the room with the big old smile on his face, just like, we're all done, everything went great, and that's just, it's so reassuring. It's amazing.
What's next for Leilani is she has one more surgery that will complete her repair, but we expect her to do very, very well.
When somebody asks me what my connection is to Cedars-Sinai, I feel like this is almost like a second home to us. It's like being with family.
I think it's really important to seek out an experienced center. You want to be around a big heart program, heart center that specializes in this.
Yeah, I think the best advice that I would have is just to stay strong and just be there for your kids. And
I couldn't imagine life without her. Like, it goes on. Life gets so much better, even through the hard times.